This is WFYI News Now. It's November 19th, and I'm Abriana Herron. On today's show, Governor-elect Mike Braun names a dozen individuals to a transition council focused on education. A new state report shows most local governments in Indiana have not started spending their portion of opioid settlement dollars. And we have a feature story on the role spiritual support can play in hospital care.
And every year we've seen a statistically significant improvement in persons being able to say things like, if I'm in real trouble, I have a real friend I can call.
Those stories coming up. But first, people gathered downtown Sunday evening to remember more than 80 people lost in traffic incidents in Indianapolis this year. WFYI's Samantha Horton reports the vigil emphasized the need for safety improvements on roads and trails in the city.
Candle votives were lit one by one as a bike bell chimed to remember those lost to traffic incidents in Indianapolis. Cassandra Crutchfield lost her 7-year-old daughter Hannah when they were both hit by a car on East Washington Street in 2021. Crutchfield says the city needs major changes to the roadways.
There are so many people that are killed and seriously injured in Indianapolis, and it's preventable, but it takes work to get there.
This past August, the Indianapolis City County Council passed the Vision Zero initiative that aims to reduce traffic fatalities in the city. Crutchfield says the initiative is a good first step, but more will have to be done at the local and state level to make the needed improvements. I'm Samantha Horton.
Governor-elect Mike Braun named a dozen individuals to a transition council focused on education. From WFYI's education desk, Rachel Fredette reports that many of the faces on the board are well-known advocates for school choice and longtime public service leaders.
Indiana Secretary of Education Katie Jenner will lead the group to review state agencies, develop policy, and prepare for the Braun administration's takeover. The council aligns with Braun's education platform he campaigned to voters, expand school choice, and enhance college and career readiness for high school graduates. Members include Robert Enlow, the CEO of EdChoice, an Indianapolis-based nonprofit that advocates for school choice, and Jason Kloth, who has driven policies around early learning and workforce development. Braun's transition team says that the council will keep K-12 and college curriculum focused on core education rather than political indoctrination. I'm Rachel Fredette.
Braun will take his oath of office in January, kicking off his 4-year term. A new state report shows most local governments in Indiana have not started spending their portion of opioid settlement dollars. As Indiana Public Broadcasting's Abigail Ruman reports, the total settlement fund is split evenly between the state and local governments.
Indiana anticipates receiving an estimated $925 million from national settlements over an 18-year period. A portion of the funds are restricted, meaning state and local governments have to use them for purposes like treatment and prevention. This accounts for 30% of the total money coming into Indiana. The rest is unrestricted, which means the state and local governments can spend the money however they want. The analysis includes 644 local governments, with 4 localities failing to meet the reporting deadline. Of those included in the report, 80% haven't spent any restricted funds, and 82% haven't spent their unrestricted funds. State officials say some local governments have opted to wait until the funds build up more. For Indiana Public Broadcasting, I'm Abigail Ruman.
The state has started spending its portion. The Family and Social Services Administration reported it has committed $40 million in restricted funds for programs that expand housing and peer support resources. And for our final story today, when you think about your health, you probably think about whether you've been getting enough exercise, what your diet looks like, or whether you remembered to take your medication this morning. You're probably not thinking about spirituality, feelings of purpose, connections to something bigger than you, or a general sense of community. Side Effects Public Media's Ben Thorpe spoke with health experts who say spiritual support should be a part of hospital care.
Kathy Ryan has spent months on the phone speaking with a woman in palliative care. It started as a connection made through the regional hospital system, Indiana University Health.
And we talked about everything, our entire lives, and have just become fast friends. And now she calls me and I call her, and we're like sisters, is how it feels.
Ryan connected with the woman through a program called the Congregational Care Network, which finds people support through faith groups. Ryan is a Quaker and says the relationship came as an outgrowth of her faith.
And I think her just knowing that there's someone that she could call if she were afraid means the world to me and means the world to her.
Health experts say Ryan's connection is part of an effort to better integrate so-called spiritual care into patient care, starting in the hospital. Reverend Gary Gunderson is one of the co-authors of a paper published in the academic journal Health Affairs. He argues that spirituality should be part of patient care, both for serious illness and overall health.
Let's be very thoughtful and strategic and invest money in making sure we're connected to the faith and faith structures that already exist in our communities. And that's the modern change.
Gunderson says for some people, being part of a religious group often means they have a community they can rely on. But that kind of spiritual care isn't exclusive to religious groups.
Spirituality, as it expresses in social form, congregations, social movements, people gathering together to care for one another, there is a very powerful thread of spirit in the positive social determinants.
And Gunderson says the effort isn't new, but it may be entering a new chapter as hospitals look to lean on faith networks to provide patients with support after leaving the hospital. The model often includes asking patients specific questions. So, along with asking about social determinants of health, like do you have stable housing, access to food, they'd also ask questions to assess the patient's broader spiritual needs.
Questions that might be asked include, is there a community of faith that's important to you?
This is Jay Foster. He is the vice president of spiritual care at IU and says depending on how patients answer, they might be connected to a chaplain.
The chaplain builds a relationship with them, and if it's an appropriate referral, says, hey, would you find it meaningful to have someone from the congregation down the road from you serve as a companion?
Supporters of this approach point to just a few hospital systems doing that work. Health outcomes can be difficult to track because many of the participants are in palliative care, but Foster says their numbers are good.
And every year we've seen a statistically significant improvement in persons being able to say things like, if I'm in real trouble, I have a real friend I can call.
Not everyone is confident hospitals will adopt a more spiritual approach to healthcare, however. David Craig is a professor of religious studies at Indiana University, Indianapolis.
We don't always put the money there, right? We put the money into acute and specialty care because that's what makes the money.
Craig says the faith-based approach is similar to preventative care, something hospitals have not traditionally invested in. He says long-term partnerships between faith groups and hospital systems will require serious investment.
But it's very hard to do because you need professional staff people in anchor institutions to help connect people to those resources.
IU officials would not provide details about how much has been invested in the Congregational Care Network since its launch. But Foster says their care network is already expanding into several cities across the state. For Side Effects Public Media, I'm Ben Thorpe.
Side Effects Public Media is a health reporting collaboration of NPR member stations across the Midwest. It's based here at WFYI in Indianapolis. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you liked today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.